Now, I do have a question though. So, if you looked at juvenile delinquency or high risk adolescents, as you call them, if you were like a clinician, you'd have a different inclination as to why they're behaving the way they do. You might have like a retroactive or like childhood trauma approach or something along those lines, right? Whereas
Mhm.
for you, you had the inclination that moral rehabilitation would have been the way to actually ameliorate their behavior and their cognitive and reduce their cognitive distortions. And I'm just wondering what gave you that like hint that it might be that's the not the cure necessarily, but the like the antidote to what how they view the world and how they behave with themselves and others.
Um, Apropos of that, I was struck by some work by a clinical psychologist named Stanton Staminow, and he's also gone through four editions. Moral Development Reality's gone through four editions. His book also has gone through four editions, Inside the Criminal Mind, and it's kind of controversial, but I thought it was making a lot of sense. And I call them self-serving cognitive distortions. He calls them thinking errors, but he argues that you have to be very careful with your approach. And if you use a traditional clinical approach, where you're approaching it from the point of view of the high risk adolescent as having been a victim of various, um, you know, uh, uh, parenting community type, uh, um, you know, um, adversities, um, that there's some truth to that, of course. But if that's your approach in therapy, you're running the risk of feeding into one of these self-serving, distortions of, kind of like, yes, I'm a victim, and the only reason that I'm here and you're not is that I got caught, and it's society's fault, and and I'm not perfect, but basically I just want to get out of here and live my life and so on. And so you're kind of feeding into a tendency they have anyway to want to externalize blame. And so, it doesn't mean you have to come off as some kind of ogre, but it does mean, Samino argued, that you have to give them the message that they have the potential to be better, and to live lives of responsible thinking and acting, and so not to dwell upon a strong empathy based approach where you're enabling them to sort of perceive themselves as victims, because I think Samina was right that that's counterproductive. So anyway, I don't know if that quite answers your question, but I was at that time when I was working up my contribution, and Bud agreed, by the way, that really didn't want to quite go there. We wanted to acknowledge adversity, but we wanted to be careful not to get into the why question along that line of some sort of self-pity, because it wasn't helpful as far as the effectiveness of an intervention program is concerned.
Okay, so I guess you were focused on some type of present slash future oriented rehab, right? Does that make
Right.
sense?
Yeah, that makes sense. Yeah. And in terms of the analysis that I got out of Piaget and Kohlberg was that this developmental delay had to do with a dearth of social perspective taking opportunities. That these kids basically grew up in erratic homes for the most part, authoritarian rather than authoritative kinds of parenting, abuse, neglect. And that so that what they really needed was opportunities to really take into account other people's perspectives, not as objects to overcome, but as people who are subjects in their own right. And I can mention, by way of another anecdote, an early meeting that we did in the EQUIP program that kind of illustrates how this group work, that Bud was so good at, how that addressed that. But anyway, so that was the idea, is to think of things in terms of remedial social perspective taking. And I to this day, I mean, that's a big theme. And then also very non-relativistic kind of mindset where you're very aware of these self-serving tendencies, and you teach the juveniles to identify when they're doing that, when they're making what Seminar calls these thinking errors, and how to correct them. And so some of the exercises, especially with the anger management component, some of the exercises are along that line of, now, wait a minute, what self-serving errors are you making in the way you're thinking in the situation and so on, and how do you need to correct them? So again, we have a very non-relativistic kind of approach where there's responsible thinking, accurate thinking, and versus self-servingly distorted thinking. And that's a big feature of the way we do cognitive behavioral, is to emphasize those needs. And again, that's really Stanton Samanow's influence on the program.